This is a silhouette type of lift. It utilizes a suture material that has a very special cone edge. It allows us to advance the tissue over the cone and kind of pull it in the direction that often you want to kind of demonstrate, in the mirror. Well, this is what I want, doctor. This is about what I want to see, happen. Not everyone is a candidate for this. The kind of candidate that we're really looking for this particular kind of material and this utilization of the suture is a patient who doesn't have an extreme amount of laxity, has a very subtle degree of laxity, say through the nasolabial folds or the cheek region, down through our marionette crease, or even through the neck. But that mild to moderate degree of laxity, is what we need, but also some thickness to the natural skin, as well as that subcutaneous layer. This is the marker for our suture material. These demonstrate where the little cones are in place on our suture material. And what we do is we're basically going to want to say, well, we'd like to redistribute the tissue along this line right here. We call that a vector. And if we do that, we place it along that vector. We know that we need to come down below the line of the crease and the marionette line here. So what we'll do is we will mark an exit point for that vector right there, an entry point for the vector right here in the center, and an exit point, which is basically along that line. So the vector lines are going to follow this direction right here. The directions of the arrows. And so when we place the suture, what we're trying to do and accomplish for Darlene is this. Now we'll go and mark the other side. What we're going to utilize is a little bit of local anesthetic, and only in the entry and exit points to the suture. Utilization of this suture material allows us to gather tissue up over a very specialized cone. As these cone materials allow us to advance some of the tissue over it and take up some of that laxity. So what we'll do is we'll make an entry point here for the one, the suture material, and we'll pass it in this direction. And we're going to make the entry point for the other in this direction here. This is going to allow us to place that suture material along the line I've created here, the kind of line that we're hoping to resuspend, and then we can advance it over the little cones, and that's what really holds it in place. We're basically going to create an entry point right through here with a needle. Now, Darlene's not feeling anything at this stage here. Okay, so basically what we're doing is just creating this entry point here, something that allows us to pass that suture material. Now we've created the entry point right here, Darlene, and basically what we're going to do is we're going to pass that needle down to the depth point that we want, and turn it in the direction of that subcutaneous tissue, and see if we can pass it along that vector that we created a little earlier. Darlene shouldn't be feeling any pain or discomfort at this stage. She'll let me know if she does. Bring it out through this little area right through here. All right? And that's an area that we've already anesthetized. So now we're going to basically pass the cone in through the entry point here. And that's placement of that suture. Now we've gone ahead and placed sutures on the right side, Darlene, for our silhouette lift, and we're going to go do the same here on the left side. We'll make an entry point right here for her. And follow along that vector we marked previously. Have the needle. Now Darlene's got very nice thickness to her skin, very nice thickness to the subcutaneous layer that allows us to pass the suture and kind of make the most of its ability to secure tissues. Now we're going to pull, and we had shown you a little earlier the cone system. Pull that through and move to the other needle. And Darlene's been perfectly comfortable through this procedure. She says she feels us working around things a little bit. She feels us, tugging on certain things, but for the most part, no pain.
Beautiful.
We're going to try and pull the cones that go in the other direction through our entry hole, through here as well. We'll make final corrections with Darlene sitting up as well. So we're just kind of setting the tone. Shirley, you can give me a... cut this. The suture here, just kind of setting some of those cones in place. I'm tug on this side of it. We've made some adjustments on the table where we performed the procedure. Now we're going to make the final adjustments when she's sitting upright. And basically that's just a little fine tuning. We want a little bit of an overcorrection, just a slight degree. Just little by little we just work this back and forth until we see enough of a difference for it's natural enough. So that's the thing. Compare the one side to the other side and make an adjustment down low. We do place the patient back into our 3D imaging software where we've taken a photo of her before the procedure, allows her to gauge what differences we've made for her, and again, make sure she's comfortable with the changes that we've made before we clip the end of the sutures. So as a final confirmation, what we do is we place Darlene back in the 3D imaging device that we have, and we're going to make a comparison. This is her before, this morning, before the silhouette lift. This is afterwards. You know, we can see the suspension that's occurred along these vectors that we marked. On a scale of this, how would you rate the difficulty of doing something like this?
Very low. Maybe a 4 or 5.
Out of a
Scale
10,
of
right?
1 to 10. Mm-hmm.
Some discomfort associated with it too?
Very little. Just more of a pressure and a tugging.
Tugging and us kind of working around things. So, you know, on the average, it's probably about an hour procedure. So, you know, Darlene does, you know, as I said, a lot of our technical work on our aesthetic patients. So I think she can basically tell them what to expect.